evening, everyone. 10 o'clock, I'm Doug Dunbar. We're getting some grim numbers that are all new tonight in this coronavirus outbreak. 242 newly reported deaths. More than 14,000 new cases reported today alone. This is in the region in China that's right at the center of the outbreak. As the virus spreads around the world, new fears now from doctors at the Centers for Disease Control that it could start spreading in communities here in the United States. Caroline Vandergriff live to get us underway tonight in Dallas with some new information. We want to focus local about the way that North Texas is preparing right now. Caroline?
Doug, a potential patient with the virus could walk through the emergency room doors of any hospital in North Texas, so they all have to be prepared, especially as health officials expect to see more and more cases in the U.S. in the coming days and months ahead of us now. Now, just this week, this letter was sent to medical facilities across the state from the Texas Department of State Health Services, outlining the best ways to deal with potential coronavirus patients. The protocol includes reporting any possible cases to the local health department. Dallas County Health and Human Services says it's actively working to minimize any spread in the U.S. by practicing the same response coordination used for other illnesses like Zika and Ebola. They're also currently monitoring people with a travel history to China. The DFW airport is one of 11 airports in the U.S. receiving and screening people who have recently traveled from or through China. Many of them are now under voluntary quarantine at their homes for 14 days.
I mean, we're working with the airport screening activities. If there are any persons that, have traveled from that area, we're doing the monitoring and contacting, people and checking to make sure that they don't have symptoms and, twice a day, and that they don't have fever.
Tarrant County Public Health is reviewing possible locations right now to house travelers who have been deemed high risk for this disease. The CDC is also working to make testing available to state health departments and other labs. Doug?
So, question before you go. How would testing within the state versus sending it out of state obviously help stop the spread?
Well, right now, if a local health department suspects someone has the virus, they have to send those samples all the way to the CDC in Atlanta for testing. If they could do it locally, they could identify those patients a lot quicker.
And can we go over best practices one more time again? Anything people can do right now to best protect themselves from this virus?
Absolutely. Well, there are no confirmed cases of the coronavirus in Texas. Still, it's a good idea to do all those prevention methods you should be doing to prevent the flu, like washing your hands with soap and water. That will help prevent a virus like this as well.
Caroline Vandergriff, some great information tonight. Thank you so much for bringing us up to speed.